everybody, and welcome to this afternoon's edition of Making Data Good for Society. So I'll be your host today. I'm Lisa Allen. I'm a director of DAMA UK and also the head of consultancy at the Open Data Institute. So this event is co-sponsored by BCS, Data Management Specialist Group, and DAMA UK. For those of you who don't know us, so BCS is a professional body for computing with a mission to make IT better for society. The Data Management Specialist Group, part of it, is there to promote better use of data by running data-related events and supporting development of data-related standards and guidance. For those who don't know, DAMA UK is the go-to organisation for data management professionals, and our mission is to nurture a community of data professionals in the UK to champion the value of data management. So we've co-sponsored the event, and this is a number of events this week, every day at 11 AM and 4 PM. So if you've missed any of them, don't worry, you'll be able to get them on catch up. But if you still want to book in, there's still time to do the rest of the events all this week. I'll just go through. So for attending this event, you can get a discount in the BCS bookshop available this week. You get 30% off the list prices for the data related titles. So that's only valid this week, but there's quite a number of titles there that you can get at that value. So before we start, let me do a little bit of housekeeping. So just to let you know, the session is recorded today and it will be available to the BCS member and your members group on the YouTube channel and on the DAMA website after today. So, and we're also really lucky to have journalism with us today. So they'll be capturing the events this week in a fun and engaging digital version of a visualization, which we'll share with you today. So we'll look forward to Alex showing us what he's come up with. So you are all muted, so but we'd love you to ask questions of our presenters. So they've made sure they've got lots of time for your questions. So please do put your questions in the chat. Don't feel like you have to wait to the very end, because actually it would be good if you just put them as they come up. So yeah, we've got about 20 minutes at the end for those questions, so please do that. So to introduce the speakers today, we have two speakers. So I'm really pleased to welcome Carly and Sam. So and they are from the partnerships at Humanitarian OpenStreetMap team. So I'm sorry, Carly is from the partnerships, or head of partnerships at the Humanitarian OpenStreetMap. And Carly's previously worked in innovation at Plan International to advance children's rights and gender equality. And she's also supported the setup and innovation as a service and worked together with teams around the world to develop new products and services and initiatives for social impact driven by girls' and young women's needs. And we also have the pleasure of Sam as well. So Sam is also from the Humanitarian OpenStreetMap. HOT, I think you call yourselves HOT. I'll go for that. He's been with HOT team since 2019 and discovered it through the Missing Maps project, which sounds great, in Edinburgh, and has supported the Missing Maps of London mapathons ever since. So that sounds something great to get involved with. So thank you guys, and I'll pass over to you.
Brilliant. Thank you so much, Lisa. Yes, Humanitarian OpenStreetMap team, bit of a mouthful, so we can refer to ourselves as HOT going forward. So thank you so much, everyone, for joining. We're so excited to be here on behalf of HOT staff, the wider volunteer community, and our partners to share about our collective work. So I'm Carly Redhead. I'm based in London in the UK, but head of our global partnerships team.
I'm Sam Koch. I'm based in Madrid in Spain at the moment, and I'm a partnerships associate at HOT. Before we kick off, if you don't mind just posting into the Zoom chat where you're calling in from. So you could be specific about, if you're coming from the UK, you could be specific about where you're calling in from the UK. And potentially the organization you work for as well. That'd be great to see just in the Zoom chat quickly. Thanks very much, Aaron.
Great. And whilst we learn a little bit about you and where you're based, we're going to just walk through what we're covering today. So we're going to share a bit about who HOT are and a bit more about OpenStreetMap in case you've not come across it before. We're going to talk about the COVID-19 response from our partners and the communities we work with. We're going to talk a little bit about the next 5 years and an exciting project we've been embarking on, and finally, some information about how you can get involved if you'd like to. So who are HOT? HOT is an NGO or a non-governmental organisation which supports communities and OpenStreetMap contributors to map areas that are vulnerable to disaster and affected by poverty. Many of the locations that are vulnerable to disaster and where services like education, health, water and sanitation are least accessible to the population are often the least mapped. So these communities might rely on an outdated hand-drawn map. And maps are really critical in the hours, days and weeks after a disaster to ensure that support can be provided. In terms of a digital map, OpenStreetMap or OSM is often the most accurate map source there is. And we're working with OSM and communities to build this free and open map of the world, what we call OpenStreetMap. So by combining OpenStreetMap, open source tools and local knowledge, we support these mapping communities around the world to create and provide map data that can be used for humanitarian action and disaster response and development. And I'd like to just take us back to 2010 and just explain why HOT exists and where it all began. And our journey started on January the 12th in 2010 in Haiti. You'll remember probably the Haiti earthquake. It caused devastation in a country that was already experiencing extreme poverty. The damage was particularly severe in Haiti's capital, Port-au-Prince. 200,000 people died. And when the earthquake struck, an international response grew immediately. However, when the response efforts reached the ground, the responders had a real challenge of being able to effectively coordinate their efforts. And this was down to a lack of maps. So what you can see on the screen here is the state of the map on January the 12th. Really poor representation of the reality. And that's right at the start date of the crisis. There was no up-to-date census, no digital birth registration, no up-to-date map, but actually around 1 million people live in this area. Very different to the maps that you and I might see as we open a lot of apps that we use day to day. Now, the second image that you can see is 18 days later. An internet community of approximately 600 volunteers came literally out of nowhere and rose to the challenge of digitally helping. They used pre-earthquake satellite images and mapped within 18 days the entire city of Port-au-Prince. So on the left, the digital map shows no buildings in the area, whereas OpenStreetMap has thousands of buildings shown, and that's on an open source platform that all NGOs could use. At the time, the map was used for search and rescue. People were literally being pulled out of trapped buildings. But then 10 months later, there was a cholera outbreak and it spread rapidly to up to about 800,000 cases. Cholera, as many of you know, is caused by bad water, and you need to map two things. Firstly, you need to map where the people who are getting sick are coming from. And secondly, you need to map the water source that they're drinking from. But they weren't able to do this. Once they were able to get their hands on the data from OpenStreetMap, so this digital map, they used that to triangulate the source of cholera and then end the outbreak. So that shows that this value of this open source map that was originally created for disaster response could actually be used by anyone, anywhere, and it can be used for others too in the future. So a lot of people might assume that Google Maps and similar commercial services have solved the issue of maps. And this might be the case in the US and in Western Europe, but there's a huge amount of inequity in these systems, and there are significant gaps in coverage in Africa, in South America, and Southeast Asia. And these are locations where official or government data is also lacking. So map coverage is still uneven across the globe, and we're talking billions of people that are not represented. And HOT is supporting these mapping communities and organizations to create and provide data and maps that can improve outcomes. That's why we're working towards a world where everyone's counted, where map data can be accessible and it can be used in decisions that save and improve lives, and also a place where everyone can engage and contribute to the map. We recognize we cannot do this alone. We need to partner with communities, with governments, with NGOs, and with volunteer networks to ensure that the map data firstly exists, and secondly, that it's actually used, and that local people can lead on problems that matter to them. So OpenStreetMap, the map that you see in the background that's kind of zooming in there, it's like the Wikipedia of maps. Anyone, anywhere can edit it, and it's a public good, so that valuable data can be used by all local actors. Everyone can access the information that's on this map. And it's free and it's an open map. So it's open to access, to use, to download, open to incorporate in offline analysis and applications as well. And I mentioned before that maps are critical in the hours, the days, the weeks after a disaster, but they're also key in anticipatory action too. So for example, in climate action, in helping communities prepare for the next major disaster that may or may not strike. I'll share a couple of examples of projects that we've worked on, but you'll hear a lot more from Sam later around the COVID response work that we've been very occupied with. So some examples of environmental mapping projects that help monitor changes in environmental features such as coastal erosion, wetlands and local biodiversity can help tackle issues like climate change and flooding. We've done a lot of work in mapping for disaster risk resilience. Our colleagues in the Philippines where it's, I think, the third most disaster prone country in the world, they've been working with local governments to create preparedness plans that can build resilience. Back in November 2020, you might remember Hurricane disaster that brought wind, rain and storm to the coast of Nicaragua. Volunteers helped to map so that first responders could understand where the flooding was, where the landslides were, and where they should send help and assistance, and also to be used in rebuilding. We're also supporting many inclusion projects, from pursuing LGBTQ inclusion and representation in mapping, to empowering women and girls to create gendered data about issues that affect them. So an example of this is a community development organisation, Crowd2Map Tanzania. They've been helping to end FGM, or female genital mutilation, in Tanzania through mapping rural areas. And this is because they need to help girls and women who are at risk and help FGM activists and police through better provision of maps and ensure that that data actually exists. So how does it work? Well, our model is all about local people and local tools. It involves providing local people with these local tools, and community strengthening and empowerment is key. So sharing accessible tools and know-how so that communities can lead on mapping what's important to them. That includes everything from data collection to data analysis, to maps and information that can then be used in government policy, prioritization, and infrastructure development too. And you can see here community participation with locally appropriate methods, if we just click back, and tools that can work on kind of Android apps, and also training on a whole range of things so that communities can lead on this and can scale this as well. So what does that actually look like in practice? We've got two kind of images here. On the left is the remote mapping piece. Anyone, anywhere can trace over satellite imagery. You could do this too. And we've done this a lot with various different organizations in terms of virtual volunteering. You can simply trace over the corners of a building or a road to add that remotely. And then secondly, and crucially, is the local mapping element. This is the citizen-generated ground truth data, and it can be created using a basic Android app. It can be created online or offline, and people can add the next level of detail. So is that building a house or is it a shop? How many floors are there? What is that building used for? If it's for commercial use, is there specific opening hours? The people that actually do this mapping could be anyone. They're citizens, they're communities. They could be youth mappers chapters, so young people at universities that are passionate about creating this. Also Red Cross volunteers and many more. And overall, OpenStreetMap has over 7.5 million registered users. And really the aim is bringing everyone together onto one platform so that all local actors can contribute and use the data. Instead, and what we've seen a lot in the past, is every organization, every NGO, every company making their own map and not sharing these, which leads to duplication. So having one source of truth is a really great thing. I'm now going to hand over to Sam, who's going to share a bit about what we've been doing in terms of COVID-19 response. Thanks, Sam.
Fantastic. Thanks, Carly. So every time you see an update on COVID, you see it on a map, and it's clear that COVID-19 does discriminate, and maps show you how. But what happens if that map data doesn't exist? So the COVID-19 response relies entirely, upon testing, contact tracing, identifying vulnerable population groups, and then monitoring and knowing where key facilities are. We need to get this information at the micro level. Hyperlocal mapping has been a cornerstone of this response. So Humanitarian OpenStreetMap team coordinated with local data and mapping experts in the OpenStreetMap community to support them with data creation. By the end of March 2020, so just over a year ago, the Humanitarian OpenStreetMap team put in place a COVID-19 plan to focus on three key areas. The first was to help government agencies and responders to identify where unmapped vulnerable populations were located. The second was to identify where at-risk populations of the most vulnerable people live, as well as identifying missing data on health infrastructure, such as facilities, testing sites, pharmacies, and laboratories. The third and final is to fund local mapping groups via rapid response emergency microgrants in places that are most at risk from COVID-19. So this resulted in HOT coordinating the most extensive disaster mapping activation in its history. Over the course of 2020, the response grew into a network of teams, online volunteers, national governments, and local communities supporting mapping responses around the world. 23,000 in total, 23,000 volunteers around the world helped build the map, adding 4.2 million buildings and 100,000 kilometers of road. This map data supported the needs of the Red Cross, UNOCHA, World Bank, the Caribbean Disaster and Emergency Management Agency, and 26 more local organizations. In total, 28 countries have benefited from support through remote mapping, microgrants, local community efforts, and training. So I'm now going to talk you through three separate case studies. The first is from Peru. This is kind of where we kicked off our response to COVID-19 over a year ago. The second is from an important partner of ours in Liberia. And the third example is centered around mapping for COVID vaccination, which recently started in South Sudan. So it's kind of the most recent activation we've been involved in. So first off, Peru. This is actually where we started our COVID-19 mapping activities in March last year. So the GIF on your screen right now shows the large mapping campaign that we undertook there in partnership with the Peruvian regional government in response to COVID-19 in Peru's Cusco region. So it was focused on the Cusco region of Peru. So over a 2-month period last year, over 10,000 volunteers mapped hundreds of thousands of buildings and a complete road network. The orange clouds you can see growing there, those are the hundreds of thousands of buildings being added to the map by volunteers. And those blue streaks were the road network that were mapped over the same period. So as the Peruvian government scrambled to support its citizens, it struggled to reach the most vulnerable. Incomplete and inaccurate maps can leave whole communities out of the picture when governments plan how to provide essential services. The Cusco region in particular poses challenges for its public health workers, for the Peruvian public health workers, because it has an extremely dispersed population. Its population of 1.3 million is dispersed over rural areas, ranging from inaccessible jungle to highland areas well over 4,000 meters above sea level. The existing government data there from the 2017 census mapped people in rural areas only to the village level. In the case of mountain villages or hamlets, this can mean that a community which is really dispersed over many square kilometers or mountainous terrain just comes out as one point on the map. So this makes finding and reaching individual households, let alone regularly visiting and tracing health indicators, extremely challenging. The mapping response in Peru allowed a new level of detail down to the individual household level. So using the map data that was produced over that 2 months of mapping last year, dashboards were prototyped to enable the Peruvian government to locate populations most at risk from COVID-19. These areas could then be prioritized for support through measures like hand washing stations to reduce transmission and baskets of food goods and basic goods to sustain people through the quarantine. The map data was also used to identify markets and other public areas that could potentially be places of high rates of COVID-19 transmission. Now, actually, the image you can see on your screen right now shows how citizens have used the map data in a tool called Kobo to flag where oxygen was needed in Cuzco city itself. So the map data actually helped to deliver oxygen tanks to 900 patients at home due to hospital overflow. Oxygen was delivered to non-hospitalized patients who are often safer at home, as the hospitals within Cuzco were running way over capacity. So there's too many people in them. The mapping and monitoring of this project, including data covering the patients and their carers, their locations, and the centralized drop-off and collection points across the city, was taken care of by a partner organization of ours called GAL, or GAL. This is a local partner based in Peru who use this map data extensively. Moving on now to the second COVID-19 case study that I mentioned, it's Liberia. So the first COVID-19 case in Liberia was confirmed in early March 2020. But like most countries in the region, there's no system there or infrastructure to curtail the spread of the virus. Despite efforts from the national government, new cases continue to increase across Liberia. And the information available to citizens was very limited. There were gaps around coronavirus awareness. There were gaps around information about the prevalence of cases, the availability of testing, information about where to get tested, quarantined, or treated. So iLab Liberia, a non-profit tech organization we partner closely with, saw this need for knowledge around healthcare access and infrastructure on the part of citizens, researchers, and responders. So they saw this data gap. With some funding from a rapid response microgrant, iLab Liberia were able to map all functional healthcare and COVID-19 facilities across Liberia, and they added this data to OpenStreetMap. They visualized confirmed COVID-19 cases by creating web maps, infographics, and data sets for public use. The 3-month project was done exclusively through remote mapping activities, which allowed a community of mappers to work from home in the midst of a national lockdown. In total, 24 hospitals, 750 clinics, and 20 healthcare facilities were mapped during the project. Beyond adding digital data, adding map directly to OpenStreetMap, 20 printed maps were also distributed to county health teams to support the response to COVID-19. Overall, this map data informed the government, local NGOs, and local communities on where to locate healthcare services and where to get tested, quarantined, or treated. The additional data was a vital component to Liberia's awareness and prevention campaigns. Moving on now to my last example or case study, if you will. More up to date, HOT is now working with a range of partners for the equitable rollout of COVID vaccines. So global equitable access to a COVID-19 vaccine, particularly protecting at-risk population, holds the best prospect of mitigating the impacts of the COVID-19 pandemic. The prospect of a global COVID-19 vaccine deployment will require, however, an unprecedented logistical operation and prioritization of people in need, both of which will depend on a range of map data and analysis. While most countries have sufficient national capacity for this undertaking, we anticipate significant gaps in geographic data and planning capacity in places where state institutions are weak or absent. So anticipating such needs, several agencies specializing in humanitarian mapping have formed a working group to support vaccine delivery. The aim is to provide expertise in a coordinated way and to act as a geographic information focal point for agencies delivering COVID vaccination programs. Notably, national ministries of health, UNICEF, World Health Organization, and partner organizations. So this working group, the members of which you can see at the bottom of your screen right now, will leverage the power of each partner's expertise to help strengthen the COVID-19 vaccine rollout through geographic data, systems, and analysis in 15 low-income countries with acute humanitarian needs. The example you can see on your screen right now is actually the first project we launched that's part of this initiative. Last month, we started mapping roads and buildings in South Sudan to kick off this initiative. So I'm going to hand back to Carly now. Thanks very much.
Great, and please do keep the questions coming. I can see some great questions coming in the chat. So we've talked a bit about the current work in terms of COVID-19 response and ensuring an equitable vaccination rollout. I'm going to talk a little bit about the future. Where are we heading? Well, over the next 5 years, we have a big goal, and that goal is to map an area home to 1 billion people. That's 1 billion people living in poverty and at high risk of disaster. Communities across 94 countries should be visible on the map. And in terms of impact, we're talking about people who are systemically underrepresented and in these countries that are at high risk of humanitarian crises and multidimensional poverty. We want to see an improvement in well-being, in reduced suffering, and increased resilience to respond to crises through the creation and accessibility and use of geodata or map data. So how do we get there? Well, we need to engage 5 times more mappers and grow local map edits. And that's beyond the number of contributors we've had in the past. In practice, that means working with local actors and local communities. We really want to ensure that missing maps are not a factor in human suffering or loss of life in a crisis. We want to ensure that communities are equipped and they're able to map the locations where they live and work. We really, really want to ensure that decision makers can rely on these maps and geodata so that they can better allocate resources and improve public health, water, sanitation and hygiene, everything from early childhood development and education through to infrastructure as well. And this includes the world's children. And finally, we want to ensure that women and girls are fully represented on the map as well. So how do we get there? Well, we're a global team. We're a global remote workforce. Everyone is working remotely and has actually been pre-COVID as well. But we need to change the way that we're set up and the way that we operate. And that's why we're launching 4 regional hubs. So in 4 priority regions in Southeast Asia and Pacific. Our hub has launched earlier this year. In Eastern and Southern Africa, so our hub in Nairobi has also launched a few months ago. And we're soon to be launching hubs in Western Central Africa and in Latin America and the Caribbean. So the reason we're opening these hubs is to really work on that trajectory of growing to 1 million mappers and mapping this area home to 1 billion people. And we want to strengthen our presence there. So we need people locally to lead on these efforts. And this is what we need to do in terms of prioritization is really ensure we can inspire and mobilize this open mapping movement that already exists across these regions. And we need to be decentralized. We need to move decision-making and resource allocation closer to the communities where they are and closer to the partners that HOT wants to serve. If you can just flick to the next slide, please, Sam. Great, here's a picture of a few mappers doing the local map editing part. And we want to power the evolution and growth of these open mapping ecosystems, these informal groups that want to map where they live. And that means providing support and contextualize and appropriate support and leadership. And it needs to be cultural and language appropriate. So that's why we're moving to this regional hub setup. So I'm going to pass back to Sam, who can share a little bit about how you can get involved. You can be a digital humanitarian. You can support this mapping movement from the comfort of your own home. Over to you, Sam.
Great, thanks, Carly. So the easiest way to get involved is to download an app from the App Store called MapSwipe. It works on Android and Apple mobile devices. It works on tablets as well. And MapSwipe is a fantastic app. You can use it to pinpoint where critical infrastructure and populations are located. So this allows the mappers later on who look at these areas again to focus only on areas where they know features need to be mapped. So it often allows us to narrow down very rural areas to just small populated regions. With your mobile phone, you can thereby play a part in helping communities around the world. And you can do that simply by swiping through imagery and tapping when you see features like buildings or roads. And that can be done on the move. Highly recommended. The second thing I recommend doing, if this sounds engaging, is to attend Missing Maps events. These are community events, and they happen all across the world. If you visit the Missing Maps website, you can see the events page, and you'll see there a listing of events that are occurring across the world. They're public events. You can join any of them. They all include a training session where you'll be trained how to use the tasking manager, which is the website that's used to do the slightly more detailed digitizing stage, where we're actually tracing the individual buildings or tracing the roads that we can see. Now, specifically, there is a London event, and that occurs on the first Tuesday of every month. And the next event is actually on the 6th of July. You're very welcome to sign up to that event. It will include training for first-time mappers. If you're a bit more experienced, there'll be training there also for advanced mapping. Highly recommended. These events have long been virtual. It's for every year they've been virtual. So if you see an event that's occurring maybe in Germany, but it's a better timing for you, you could attend that, and it will be a virtual event, so you can still attend it. If you're interested in putting together mapping events at the organization you work for, please don't hesitate to contact us at the email address, which is shown at the bottom of this page right now. So we often host large mapping events involving hundreds of participants, all doing that initial stage digitizing features that can be seen in satellite imagery like roads or buildings. And if you think it would be a good fit for your organization as an event, please don't hesitate to contact us, and we'll be very happy to host the session, give everyone an introduction to mapping, and tell everyone how to map. That'll be our pleasure. Fantastic. So moving on to questions. We've seen some great questions in the chat already, but thanks very much for your patience as we ran through this, and thanks very much for attending so far. Great questions. Thank you.
Brilliant. Thank you, Sam. Thank you, Carl. That was really interesting. The first question I was going to write down was where do I get the app? So you've answered that. So that's brilliant. So let's go to Alex. Are you ready to share your picture with us so we can do a summary where we've got to? So while we're sharing Alex's picture, Alex, I think you need to put the camera. That's brilliant. And Glenn, can you spotlight that for me, please? While we're running through Alex's picture, we will. Oh, we've spotlighted Sam. Can we just spotlight Alex's picture, please? Thank you. While we're doing that, if you want to put your questions in the chat, and then I shall come to those next. So yeah, here's the run through of the event that Alex has been digitally capturing. I know it's been long waited from Carly and Sam. Look at this. So I think it's starting off with how many amazing volunteers actually you've got that's helping. And the places that you've mapped, I mean, it's been really impressive when you think about the case studies you've got in Peru and others, and how it's been helping the pandemic. And the key thing about how important geographical location is, I think it's pretty phenomenal, really. And I think one of the things that's being pulled out for me is just how you can get involved. It's like the Wikipedia So I think, Alex, you've really captured all those different elements there. So more than I can go through. So that's brilliant. Thank you, Alex, for that. If we come to questions now, so if we want to switch over to Sam and Carly. So if I start off with Glenn's question then. So the Open Map Kit looks like powerful software. What's behind its global geographical location capability, e.g. what 3 words?
Great question. I'll take that, and Sam, you can chip in. So the global geographic location capability is based on OpenStreetMap.org, and that's the global free open map of the world. It's not based on a proprietary software like What 3 Words. You're absolutely right. It's powerful software. There's more information that we can share on OMK. We have a toolbox that has information on kind of field mapping management and tools like Open Map Kit or OMK. And there's also lots of information we can share in designing a map project as well. It's all available kind of free and open online. Is there anything you'd add there, Sam?
No, I think that covers it wonderfully. Yeah.
Yeah, no, that's great. Yeah, so I think that's the major differentiator, isn't it? You know, What 3 Words is that proprietary software, whereas OpenStreetMap is that free and available tool. Excellent. So next question, actually, I had this question too, Glenn, about how is the data provided verified to ensure fair distribution of aid and resources? So I think the first one is about the verification, and then thinking about then how do you provide that distribution of aid and resources?
Wonderful question. Yeah, so there are several stages in the whole mapping process. And the initial stage, which we've talked a little bit about, is the remote mapping stage. And that's where volunteers look closely at satellite imagery and trace the features that they see. So they trace buildings and roads, for example. They occasionally make mistakes at that stage. Even experienced mappers make mistakes at that particular stage. We have a second stage built into the process, which is known as the validation phase. And that's where more experienced mappers, very experienced mappers, look at the areas which have been mapped, and they check the quality of the mapping, and they fix any errors if there are errors, or if people have been mapping accurately and nicely, they'll approve that work quickly. So it goes through this data quality checking stage. Everything that's added at the first stage by the remote mappers is checked by a validator. And that's before the data is taken to the field, at which stage local mappers add the additional color, add the extra important details. For example, the information about the actual function of a building, whether it's a hospital or a school or a house, for example. So in that third stage, there's also another, in essence, validation stage. The data quality is checked again by the local mappers on the ground, and they have the best information available. There's nothing better than the local context and walking around a neighborhood to get the maps as accurate as possible. So it's those two following stages, following the initial mapping stage, that the data quality is improved, and we can assure our partners that the data quality is of a high standard once it's been validated by our fantastic community of global validators. Great question, thank you.
That's really good. So I suppose it's akin in some ways, is it to the Wikipedia model? So thinking about, you know, that you've got those people who are, you know, almost custodians looking after it there, making sure there's checking all the work of the volunteers. And I presume, is there any prioritization? So leading into Glenn's question about, you know, to ensure the fair distribution of aid or resources, is there prioritization, or is it as the information comes in?
Really good question. So the mapping always happens in response to a need or a request. So a local group or a local organization would say, you know, I don't know, MSF operating in, let's say, Botswana will say, we need to do this response work. We therefore need a map to be able to navigate the space and do it effectively. Can you help create that map? So as in terms of like fair distribution of aid or resources, it's responding to a need. We don't necessarily have at the moment an influence on that fair distribution, but we are hoping that in the future we can do more work in the advocacy space as well around fairness and distribution.
Yeah, That sounds good. Excellent. Glenn was busy on the chat today. So Glenn says, what happens to the created maps after the immediate crisis is over? So who would like to take that one?
I'm happy to take that. Yeah, great question. Once the beautiful thing about OpenStreetMap is that once data is added to the map, it's there to be edited and to be improved upon forever. Once data is added to the map, it's often our hope, and it's often it's what we try and pursue and we try and encourage, is for local communities to improve and to add color to that map data, and so that it continues to have a life of its own, that data that's been added. And that as settlements grow, for example, as settlements develop, that new data is added by local communities, and then the map is incrementally improving over time. But you do need to develop a community in that region for that to happen. So a lot of our work is in attempting to support the development of communities all over the world and where we are mapping. Yeah, great question there. Thank you.
Excellent, thanks for that. And then we have a question from L. Kelly. So have you been able to explore the use of automation to undertake some or all the remote mapping activities?
Yeah, that's a great question. And we get this question a lot because when you're drawing buildings on the map, or you're drawing roads on the map, sometimes it can seem like, oh, couldn't this just be done by a machine? And it's a great question, and it's something we are actively exploring. We've been working with a number of partners to create tools which automatically recognize features like roads or buildings, and they're not bad, but they do require a human to check on the quality of the suggested data before it's actually added to the map. So it does actually require effectively kind of sign off from a human being before that data is added. It needs a kind of quality checking stage. So suggestions are made, but they're not directly added to OpenStreetMap. And this has worked pretty well for roads in particular, for recognizing roads. Machine learning is not bad, and we've been using it recently, actually in South Sudan, where we were mapping for COVID vaccination, and we were using an editor called Rapid, which is an AI-assisted editor which suggests roads, and it can save you time because you don't have to painstakingly draw the road. It's instead suggested to you. But it does require someone to check that road is correct and to classify that road, to tell us if that road is just a small track, or if it's actually a major road. It actually needs someone to classify that. So it's getting there. It's tricky because the imagery we use is great, but often in compared to lots of countries like USA and many countries in Europe, imagery and image quality is not fantastic. So we have to use fairly low resolution imagery. So recognizing smaller features like buildings is very tricky using grainy imagery. So it's tricky, but we're getting there slowly. It's a great question.
Brilliant, thanks for that, Sam. And then we've got a question from Martin Newman. So is there a potential to use this to record historic sites at risk of looting or destruction? Yes.
Good question. One I don't have the answer to. Sam, any thoughts on that one, or do we need to, should we come back to Martin?
Yeah, I mean, you can, if they're not on OpenStreetMap, you can add, you can map historic sites. There's particular tagging specific to historic sites, and adding them to OpenStreetMap is a great step to make to recognize features like that. So absolutely, yeah, no reason not to. And OpenStreetMap would be a good source to go with when you're mapping that kind of data.
Excellent, that sounds great. And then we've got Simon Green from Ordnance Survey. So do you have a computer vision capability from imagery that can help to build a foundational base map quickly, like roads, buildings and water, so it then can be enhanced, validated by ground truth volunteers, perhaps the collaboration with partners? I think that was what you were touching on before there, Sam.
Touching on before, yeah, essentially relates to the same thing, and as mentioned there, it's the base map data that it can attempt to provide, and you're actually mentioning the process really there, in fact, which is that it does need to be checked before it needs to be approved or checked before it's added to the map. But yeah, exactly, that harks back to earlier comments about machine learning.
Perfect. And then Mark would like to know, how's the data stored?
Good question. Yeah, it's stored in OpenStreetMap's database. It's stored in a old-fashioned database. And that database is located on several servers distributed around the world. Yeah, and some people kind of call OpenStreetMap just a database, but it's more than that, I think. But yeah, it's stored in a database.
I can see your warm feeling towards it. It's important data. And Glenn would like to know, how is HOT funded?
Yep, I can take this one. So this time a year ago, HOT was really lucky to receive funding from an initiative called the Audacious Project. It's a collaborative philanthropic initiative, and it's meant to be a springboard for social impact. And that's why we've got this really big goal of mapping an area home to 1 billion people. And they worked with us to think about this strategy for the next 5 years and think about how we can scale up all the work to date. So that includes different kind of philanthropic funders. We also do receive donations via our corporate partners and sometimes individuals as well, and have historically ran kind of fee-for-service projects with institutional donors as well. I will ping a link to the Audacious Project for anyone interested. It's kind of hosted by, they host TED, you know, like the TED Talks. So we were lucky to have one of those.
Excellent, thank you for that. So I think we've gone through all the questions now. So I think that's pretty amazing. I think you've done a brilliant job of whetting our appetite about how important mapping is and actually how we can all get involved. I've written down the app. So we'll definitely be getting involved with that. And I think one of the things that really came out for me is just showing how much of the world isn't mapped and the gaps we've still got there. And I think that really shows, I think we're in an amazing position in the UK with the mapping we have available, but actually that's not the case all over the world, and that's really important to bridge that gap. So you are doing a brilliant job. So yeah, everyone's saying great job, guys. Now if I come to Alex, have you mapped out the question? Not mapped out, I've got maps on the brain now. Put out the question, so we're going to have a little look, see what we've
hang on.
Yeah, one moment. Here we go. So these will be your questions that will be coming through. So Alex will be completing this. So yeah, about the verification that's coming through and how it's checked and moderated, and that automation, essentially the future of machine learning, and how maps have a life of their own. That's awesome. And yeah, and where it's kept. So that's all the answers that are coming out from the question. So yeah, that just leaves me to say thank you actually to journalism as well for your work on this. And I'll just go through some closing. So just a reminder that that the events are recorded, so we will save them and we will share them on the BCS and the DAMA websites for you. If you've missed any of the sessions, you can catch up there. If you want to attend, there's more sessions this week and at 11 AM and 4 PM every day this week. And it just leaves me to say thank you to Carly and Sam. That was brilliant. And yeah, I think we've all learnt a lot, and I think we've just added to your community. So thanks everybody, and it's been brilliant to see you all. Have a good evening. Thank you.
Thank you so much. Thanks, Lisa. Thank you so much. Thanks, everyone.